Hello, I'm Paul Peterson for Aging in LA. Do we have control over how fast we age? Let me read you a quote from today's guest. Your most valuable possession in life is your physical well-being. With it, you have everything. Without it, you have nothing. Our guest today, Dr. Art Mollin, has a simple formula for an anti-aging program that includes diet, exercise, positive mental attitudes, and enlightenment. Stay tuned for Aging in LA. How would you like to have increased longevity, be able to function at the pinnacle of your physical and mental capacity, and lower your risk of heart disease, cancer, and diabetes? Thousands of patients have used the formula developed by our guest today, Dr. Art Mollin. He's a practicing osteopathic physician in Phoenix, Arizona. His medical practice, the Mollin Clinic, emphasizes the benefits of preventive medicine. He is a proponent of exercise and diet as the primary treatment modality for many diseases, including hypertension, heart disease, high cholesterol, arthritis, and depression, through the use of exercise and diet. Dr. Mollin attempts to reduce the dosages of prescription medications. He is also enthusiastic about alternative remedies, including herbs and antioxidants. Welcome, Dr. Mollin. Thank you so much for joining us today.
Great to be here, and it looks like you're following the program, so I don't have any recommendations for you at all, Paul.
Oh, boy, it's the regimen imposed by this show. They're saying, well, we'd like to do a show on exercise. You'll do that, won't you, Paul? The next thing I know, they have modified my diet. And I do feel a lot better.
Yeah, there's no question about it. The diet is very, very important. It's an integral part of the whole program. So the keys for anti-aging would be exercise, diet, positive mental attitude, and of course lying about your age is very important. So that's very important.
I'm actually 80. They gave me the book that you have out, which anybody can get at their Save-On and Albertson.
Sure, right.
And it was arresting. I started to pay attention and reading because you're not trying to fool people. It's like, look, folks, this is common sense.
It really is. It's a very pragmatic attitude towards lifestyle changes that you can implement to lower your cholesterol level, lower the risk of heart disease, lower the risk of cancer, basically prevent diabetes. It's based upon some very sound scientific evidence. It was based upon a study that I had reviewed over several years, and it's the Grand Prix study of epidemiology ever done in the world. It was done on 6,500 Chinese, and they studied these Chinese over a 9-year period, and they found they had 1/16 the incidence of heart disease of Americans,
wow,
1/5 the incidence of colon cancer, 1/4 the incidence of breast cancer. They did not develop diabetes, and they actually consumed more calories. It was simply changing the calories and the implementation of the exercise along with it. So I am a proponent of this whole program simply because I've seen it work with so many of the patients that I have actually been able to get motivated to stay on this type of a program.
Well, and you speak about motivation so well because, well, first of all, you're a living example of this. You're like a marathon guy.
Well, I have run 34 marathons, so including 3 Boston marathons. But
I've watched that, man.
Well, it's just important to me. I mean, I spend 2 hours a day exercising. It's the most important part of my day. And then from there on, you have a positive mental attitude. It allows you to function at the pinnacle of your creativity and your productivity every day. On a scale of 1 to 10, I feel that most people function at about a 4 or 5. And if you were able to exercise every day, you're going to function at about a 10. So I think it changes your whole attitude for the rest of the day once you've implemented that exercise.
Yeah. And that's the best time of day to do your exercise, right? First thing.
The reason it's the best time of the day is because most people will stick with an exercise program if they do it in the morning. I've done studies on my patients, and I found that the ones who exercise in the morning, 75% will comply with that exercise program 1 year later. The ones who exercise at noon, only 50%. And if people leave it for the end of the day, the recidivism rate, the rate of them going back to their old habits, is much greater. So only 25% will stick with an exercise program if they leave it for the end of the day. So the primary time is in the morning simply because of a compliance standpoint.
And I get that, and it's important for people to know. No, this is not something you put off to the end of the day.
No.
Discipline yourself and go for it. Why not?
It should be a priority for everyone to exercise in the morning. And when people say, should I exercise every day, my question to them is, do you eat every day? You know? Right. So if you're planning to put energy into the body, then you should be planning to expend energy out of the body. It's critically important to exercise every single day. And it doesn't have to be an intense exercise. Most people feel as if they're going out to exercise the same way they did when they were perhaps in high school gym class and they had to run around the track and be breathless. It should be something that's easy. I don't care what exercise it is. It can be biking, running, swimming, hiking, some type of exercise every single day.
Well, people, it's easy to let things slide.
Yes.
And suddenly you find you've got that extra 25 pounds on your body and you're not getting the exercise, a little shortness of breath going up the steps. Okay, a person has recognized that. They come to you. How do you start with them?
Well, first of all, what we do is we do a complete physical examination. I think that's critically important in order to discern if there's any underlying heart disease, if there are any anemias or any other physical problems that would preclude them from doing an exercise program on a regular basis. Right. So I think that's very important. We do a stress electrocardiogram, have them running on the treadmill. Right. That can discern if there's any underlying cardiovascular disease, hypertension, or anything like that. And then pretty much prescribe exercise. So I prescribe exercise the same way as other doctors will prescribe medications. It's like, take 2 miles and call me in the morning. You know.
That's great.
Yeah.
Now, what age? When does a person? When can they contemplate getting back on an exercise regimen?
Well, first of all, you're never too old to start an exercise program. I've had patients 80 years old, and I have one particular female that I remember. She was 80 years old when I started her on a walking program. We took a picture of both of us. She came back to see me at 101, and she was still walking 2 miles a day. And then she took another picture, and she told me that when she sent the picture back to me, she said, I think I look younger than you do.
Isn't that great? Well, now, things like bone density. Can a person, say, 65, 70, increase their bone density?
Yeah, absolutely, and bone density is critically important because of the risk of osteoporosis, the demineralization of bone as you get older. But one of the other things we learned from that scientific study of the 6,500 Chinese is that if you were to consume a diet which is very low in animal protein, which is the diet that I recommend, then your body will retain more calcium. If you eat a diet that's high in protein, you're going to wash the calcium out of the body. So it's critically important for people to follow the diet that I recommend, which is basically one which is the antithesis of all these diets that you hear about the low carbohydrate diets.
A lot of fad diets.
Right. I'm not suggesting that people follow a diet that has lots of carbohydrates in it, because you should eliminate the pasta and the rice and the potatoes and minimal amount of bread. But it should be a low animal protein meal. So that means that if you have eggs for breakfast, that's your animal protein for the day, or if you were to have a fish sandwich for lunch, that would be the animal protein, or chicken for dinner, that should be the one animal protein meal of the day. I often recommend that people eschew red meat completely, because I think that's potentially cancer causing.
And when you eat is important too. I noticed in one of the paragraphs in your book you were saying this is not to eat your primary meal at 10 o'clock at night and go to bed.
No, you should.
Bad idea.
A very bad idea. You should actually try to eat earlier in the day. The less you eat at night, the better it is for you. I mean, Thomas Jefferson once said you should eat breakfast like a king, lunch like a prince, and dinner like a pauper, and perhaps he was indeed correct, because eating late at night, you're going to retain more of those calories because your body starts to slow down.
Right. Let's talk about some vitamin supplements. Good idea? Bad idea?
Yeah, I think vitamin supplements are very important. On the other side of the coin, I don't want people to get the wrong impression that they should be taking mega doses of vitamins. There are certain vitamins I recommend. I recommend vitamin A. I recommend a B supplement. Vitamin C, 500 to 1,000 milligrams a day. You don't necessarily need more of that. And, you know, with all due respect to Linus Pauling, the Nobel laureate, who recommended 8,000 milligrams of vitamin C a day. And took them himself. Because it can be very injurious to the rest of your body, and particularly to your colon. So I think that it's important, vitamin C, but vitamin E, 400 units a day, that's sufficient for most people. And then selenium. Selenium is a trace mineral not readily found in many foods, so you should try to supplement with about 200 micrograms of selenium a day. And then folic acid, which is a B vitamin, is critically important. Now we've learned it's very important in terms of preventing birth defects in pregnant women, so they should definitely be taking it.
Right. It's, you know, it made such sense. And you would list in your book, and I'm going to again recommend this. This is not tedious reading, and you can get it at Savon's or Albertson. Just ask for Dr. Molin's anti-aging formula, and it gives you such great ideas. People say, okay, now where do I get my zinc or selenium? And you actually say, look, folks, you can get your broccoli out.
Right, exactly. You can eat certain foods to get certain supplements in there, but you don't necessarily have to take mega doses of the vitamins that I've recommended. You can actually turn to having almonds in your diet. You can turn to eating tuna to get certain vitamins and things. Blueberries are very, very high in antioxidants, so they're critically important. You can have salmon, which will give you fish oils. Fish oils have been linked to lowering cholesterol levels, and they significantly can lower triglyceride levels, the other major fat in the blood. So
and
I
be
think
cautious of salts as well.
And salt, and most people eat too much salt. Most people consume about 8,000 to 9,000 milligrams of salt a day. You only need about 2,000 milligrams of salt. There's an enormous amount of salt in most of the foods that we're eating, particularly the processed foods.
Now, when a person comes to you, sometimes they're bringing bags of medications that other doctors have prescribed.
I've had patients come in with 15 to 20 medications that they're taking. They usually leave, and I probably take them off about 50% of those. I mean, obviously the more serious medications, the Lanoxins, the Digitalis, the type medications that they're taking for the cardiovascular disease, if they're taking a beta blocker, I don't want people to get off of those drugs, but there are certain medications they don't need to be taking. One thing I really don't like is a lot of pain medications. I find that when seniors take a lot of pain medications, the first thing they develop is constipation, and all of them come in complaining of that, and then we have to try to put them on other medications to try to reverse that. I mean, it's such a cycle. They ought to be very careful of that.
It's time for a short break. We'll talk more with Dr. Art Molin, osteopathic physician, president and founder of the Southwest Health Institute, member of the Arizona Governor's Council on Health, Physical Fitness and Sports, and author of Dr. Molin's anti-aging program. When we come back, we'll also visit a doctor at the Sage Clinic in Sherman Oaks, which is committed to the health, wellness, and special health care needs of our senior community.
I remember when Dad used to help me. Boy, how things have changed.
Yes, I need to make an appointment for my father, Jose Alvarez. Right. Hey, listen, I'm going to be late for that meeting. I got to take my dad to a doctor's appointment.
It's really hard juggling my career with the needs of my dad.
Well,
I sure wish Mom was here to help. I can't do it alone.
Welcome back to Aging in LA. Our topic today, how to have control over the effects of aging through diet and exercise. Our guest is Dr. Art Molin, osteopathic physician and author of Dr. Molin's anti-aging program. But before we resume our conversation with Dr. Molin, I'd like you to meet a really swell guy, Dr. Dan Osterveld. He is at the Sage Clinic at Sherman Oaks Hospital, a clinic that is designed to help seniors caregivers, and medical professionals deal with changes due to aging through diagnosis and management of geriatric syndromes, information referral, and support services. Dr. Osterweil is also an accomplished photographer, you'll like this, and has done portraits of many of his patients. We'll see some of those photographs later in the program.
SAGE was started 20 years ago.
My. And you were the founder, correct?
Yes. Yes. We have, I just came out of the fellowship at UCLA in 1984. And while at UCLA, I was seeing patients at the Sylvia Olshan Health Clinic in the Fairfax area, and then seeing patients in the Department of Medicine at UCLA. And I noticed that people and their loved ones spend a lot of time going between appointment to appointment. So I started kind of thinking about a different approach, which is the one-stop clinic that takes into consideration the busy executive son or mother or wife that need to take dad or mom to a clinic and try to consolidate that in one place so they get all their answers the best we can in one place.
You know, this is such a great idea because the younger caregivers are informed and an integral part of their senior person's medical conditions.
Absolutely. And we look at things very comprehensively. We don't really look at the body. We don't look just at how they feel. We look at their function, how they feel, how socially they are engaged, and try to actually remedy things that we can. Sometimes by advice, sometimes by referral, sometimes by medication.
You know, the popular conception is that seniors are somehow trapped in their memories, but the truth is many seniors are laying down new memories.
Oh yeah, I mean, a lot of the seniors we interact with are very outgoing, and they really put to use all their life experience and their skills and their knowledge. They become SAGE consultants. And they essentially provide a lot of positive input to the societies they live with, to the microcosmos they live with, which is family or group of friends. Personally, my wife and I have a couple of friends who are in their 80s. One of them, you look at him, you will not say that he's even hitting the 70s. You see him, we went to the Amazons with him, and we hiked through the jungle.
Wow.
And the guy, he plays tennis twice a week. We hiked the mountain, and that's the 80, I think this is what society needs to look forward, that people in their 80s still contribute very actively and positively to society. And yes, there are some of them who need help, but most of them don't.
Even our seniors with impairments can still make contributions, can't they?
Absolutely.
I don't know of any 3-year-old who would stop sitting on your lap because you're in a wheelchair. And
in fact, you know, we have pioneered, not SAGE, but another organization I'm part of, One Generation, an intergenerational program. I was the president in 1996, and we decided to open the intergenerational component of it just for the sheer fact that kids can benefit tremendously from interaction with older people. And we interview their parents. They say the reason we come here because they learn to respect older people, and that improves their behavior at home, and we feel better about it. So there's no doubt about it.
Well, I've seen this in my own family. Auntie Ruth was a speech therapist for 35 years. And even though she doesn't know who the president is, if a youngster approaches her who has a little lisp, you know, and the diphthongs aren't just quite right, she's busy teaching again. And of course it helps if she has Tommy Dorsey playing in the background. But that got to bring a kind of special joy to your life as well, to watch families remain integrated and supportive.
Absolutely.
It's a great goal to have and target, if you will.
Absolutely.
Great. Well, thank you so much for taking the time to talk with us.
My pleasure.
My
pleasure.
I want to get right back to our guest, Dr. Art Molin. And Dr. Molin, flu shots. What's the deal with them, and are there alternatives?
Yeah, well, first of all, it's critically important for people to get a flu shot every year.
Get them.
Anyone over the age of 50 should have a flu shot every year. This year, we are actually offering flu shots in the Los Angeles area at all the CVS, all the Albertsons, all the Save-On stores. So
how do people get
they can
that?
just go into those drugstores and actually get them on the particular day that they're being offered. So they can go to molinflushots.com, which is our website,
Right.
and they can find a specific clinic nearest them. I would advise everyone, Medicare covers it, so it's a really good thing, and it's free because Medicare stands behind this. It lowers mortality and hospitalization among seniors. It saves about 40,000 lives every year. So flu shots for seniors are very, very important.
All right. And now, you were mentioning to me some of the alternatives to some of these very
Yes.
pricey medications seniors
there
are getting.
Exactly, particularly like the statin drugs. And if people are looking for an alternative to the statin drugs, they can take something like red rice yeast extract. They can buy that at a health food store that's readily available. Also, they could take niacin. They can take niacin up to 2,000 milligrams a day, and that will help to lower their triglycerides and their cholesterol, raise the HDL, the good guy cholesterol, the LDL's the bad guy cholesterol. You get all these reports now. And so people can actually take some alternatives and help to lower it without taking those pricey statin drugs. Although they're beneficial, there are indeed alternatives to them.
Well, I thought one of the things when you mentioned that oatmeal is a perfectly good breakfast beginning.
Yeah, no
and
question
I'm
about
thinking,
yeah.
I sort of learned to read reading the cereal boxes, you know, my
I
little
mean,
round.
and with oatmeal, of course, it's high in fiber. So anything that's high in fiber is going to help to lower cholesterol levels. So whether it's salads, fruits, vegetables, I mean, if there's one key to dieting and controlling your weight long term, it's fiber, fiber, and fiber.
Right.
And that's what you need to try to really locate in your diet in order to help to lower cholesterol levels as well as the risk of heart disease.
Now, do you find in your patients that once they get on track, if you will, that the mental fog and depression begins to lift?
Yeah, no question about it. You feel so much better once you are exercising. You know, years ago, there was a psychiatrist who wrote a book about running, and it was called The Joy of Running. And it basically dealt with the fact that he had taken depressed patients and put them on an exercise program. He found that for mild to moderate depression, that the exercise was just as efficacious. It worked just as well as the medication. So if anybody out there is suffering from depression, they can do that. In addition to the exercise, they could try something like St. John's wort. That's an alternative, which is often sold in health food stores as well. Glucosamine chondroitin is another alternative which people could take for arthritis. So if they don't want to take the more expensive medications like the Celebrex and the Mobic, if they want to switch off of the Advil, and you have to be careful about those medications because they can potentially be deleterious to your kidneys. They can cause kidney degradation. That's the one thing with seniors that I'm often cautious about, is if they start taking a lot of Advil over the counter or the ibuprofens, they're going to find that their kidneys are going to get in trouble.
And of course, plenty of water is the standard thing. Common sense stuff.
Common sense things, and that's what's in the book. It's very pragmatic to follow that. It's 8 to 10 glasses of water a day. If you're exercising, you should take in an additional 12 ounces of fluids for every 30 minutes that you are exercising.
Right. And I have asked you, I've given you a tip on this.
Yes.
You have seen some truly inspirational turnarounds. Can you share with us some of the stories that have affected you?
One of the ones that really affected me the most was a woman that came in to see me at the age of 63 years old. She was on about 15 different medications. We weaned her off the medication, started on a walking program. She had heart problems. We started her walking 1 mile a day, 2 miles a day. Within a year, we had her up to the point that she was actually jogging about 4 or 5 miles a day. 2 years later, at the age of 65 years of age, she still took a couple of medications for her heart, but she ran the 26-mile marathon. Not only did she run the 26-mile marathon, but she became the world record holder for 65-year-old females in the 26-mile marathon, running it in 3 hours and 54 minutes. So there are some incredible stories. Edna Laughlin is one that I share with you today.
Well, yeah, that's amazing. But there was another aspect of speaking, really, this is a spiritual matter. Laughter, a positive mental outlook, to seek it out, not wait for, some comic to show up at your door.
Absolutely. I mean, laughter is very, very beneficial to your health. I mean, not only, and they've studied the physiologic changes in terms of your diaphragm and your stomach muscles and your chest muscles and just utilizing those, but we realize that laughter is actually beneficial. It increases endorphins, beta endorphins in your brain, which give you a positive mental attitude. So people ought to be laughing as much as possible. There was a Saturday Evening Post article years ago in which someone who had cancer locked himself in a room and basically for about 2 or 3 weeks watched the Charlie Chaplin movies and Norman Cousins, exactly.
Oh, I recall.
And he watched these movies and Charlie Chaplin movies and Three Stooge movies and things like that, and supposedly cured his cancer. So laughter is indeed beneficial to your health.
Please get Dr. Molin's book at Albertsons and Save-Ons. You'll enjoy the read. You get good recipes, inspirational stories, and it was wonderful. And as I told you, I can't get it away from my 90-year-old mother-in-law.
Well, and hopefully she's in the kitchen cooking for you.
Oh, absolutely. I'm looking forward to dinner.
That's right, making all the recipes and diet plans that we have in there.
Thank you again for coming here and bringing some sense to this this notion of diet and exercise.
It doesn't have to be as complicated as it seems.
Yeah,
it's very pragmatic. Health is far more simplistic.
Right, and those 3 keys again were?
It's exercise, it's diet, it's positive mental attitude, and lie about your age.
There you go. Our time is up for today's program, and thanks so much to our guest, Dr. Art Molin, osteopathic physician, president and founder of the Southwest Health Institute, member of the Arizona Governor's Council on Health, Physical Fitness, and Sports, and author of Dr. Molin's anti-aging program. And before we close, I'd like to show you some of the great photographs Dr. Dan Osterveel has taken over the years of his senior patients. How did you get started with the photography?
Well, I've been photographing for years, but I never showed it. It was in boxes and in drawers. And my older daughter actually convinced me to open up. And the trigger was actually a bet that we had. And I lost the bet, so in order to redeem myself, I had to do something, and I found a friend, one of the artists at UCLA, who has actually opened her gallery to me, and I had my first show in '98.
It's got to be a great challenge to work with seniors in your photography because their life shows on their faces.
There's so much beauty in faces and in older faces that people really lack the appreciation to. I do have the appreciation because I think that people think only young and beautiful is what is beautiful. I see a lot of beauty and strength. And I can see in serial photos changes and that the story cannot be told. But if you look, you see. And the eyes tell you things that sometimes the words don't.
Yes, a picture is worth 1,000 words. It was such a joy to meet and visit with him. I'm Paul Peterson for the Los Angeles Department of Aging, the people here at CityView Channel 35, and all of our guests on Aging in LA. Thank you so much for watching, and we'll see you the next time. Dr. Molin, again, thank you.